is that sex workers in their diversity are widely stigmatized population and extremely vulnerable to sexual reproductive health outcomes related to having multiple sexual partners, such as unwanted pregnancies, getting infections, sexually transmitted infections, gender-based violence, and many others. Most of the times when we are accessing services at the health facility, most of the times we are actually branded as vectors of diseases. Even that was witnessed during the COVID-19 pandemic, where they used to say that sex workers, we are the ones who are spreading COVID-19 among the population. This kind of branding, calling us vectors of diseases, has put us to be a threat to the community, and which is more of a discriminatory and stigmatizing term to us. Even when accessing services at the facility, most of the time the poor attitude that health workers project towards us, it's something that is actually more common in most of the health facilities, and this has affected our access to comprehensive SRHR services in most of the facilities here. One recommendation I would want, some of the recommendations I would want to put out is to push for health planning committees to always consider sex workers in their planning. For this, I call for meaningful involvement of sex workers in planning for health services that are targeted for them, and also to address the information gap in terms of sensitizing the community about the services that are available at facilities, and translating the materials, the information materials that they put out in the communities for sex workers to really understand what kind of services they would want to access and in what way would they be able to access them, and also to work around reducing the stigma and discrimination in the health facilities, because most of the times the health workers are the ones that are most stigmatizing in a way. Their attitudes are poor, so working around reducing the stigma and discrimination of health workers towards sex workers will actually be key in this in the entire process of trying to bring close sex workers to access health services in the facilities.